Are there mental health risks associated with Ashkenazi Jewish genetics? Have you ever wondered if genetics can play a role in mental health, especially within specific communities? Today, we are focusing on Ashkenazi Jewish genetics and their potential mental health risks. Research shows that there are indeed mental health risks linked to Ashkenazi Jewish genetics. One of the most significant concerns is an increased vulnerability to schizophrenia. This chronic brain disorder can cause symptoms like delusions, hallucinations, and disorganized thinking. Why is this the case? It turns out that certain genetic mutations are more common in the Ashkenazi Jewish population. These mutations contribute to a higher risk of developing schizophrenia. The unique genetic history of this population, which includes a relatively small ancestral group and a tradition of marrying within the community, has led to a more uniform genetic background. This has allowed specific gene mutations to persist over generations. Another important factor is related to lysosomal enzyme disorders, such as Tay-Sachs disease and Gaucher's disease. These disorders are more prevalent among Ashkenazi Jews and are linked to chromosomal regions that also play a role in schizophrenia risk. Studies indicate that families affected by schizophrenia often show elevated rates of symptoms associated with these enzyme disorders, suggesting a genetic connection. Additionally, there is growing attention to conditions like Obsessive Compulsive Disorder, or OCD, within the Ashkenazi and broader Jewish communities. OCD can sometimes resemble strict religious practices, making it challenging to distinguish between the two. While OCD involves intrusive thoughts and compulsive behaviors that cause distress, religious observance may not carry the same emotional burden. The genetic risks for mental health conditions in Ashkenazi Jews can also be explained by the founder effect. This phenomenon occurs when mutations in a small ancestral population are passed down through generations. For many genetic diseases, including those affecting mental health, a person needs to inherit two copies of a mutated gene, one from each parent, to develop the condition. Understanding these genetic risks is vital for the Ashkenazi Jewish community. It can guide genetic counseling, early diagnosis, and treatment strategies. Advances in genetic research are improving the ability to identify individuals at risk and develop targeted therapies, especially for schizophrenia, which often requires ongoing medical and psychosocial treatment. In summary, Ashkenazi Jewish genetics are associated with increased risks for certain mental health disorders, particularly schizophrenia, due to specific inherited gene mutations. Awareness and appropriate medical support can help manage these risks effectively within the community.